Welcome to the Movement PT Coffee Cast, where we sit down and talk about physical therapy, health, and whatever else comes to mind during our coffee-infused conversations.
Welcome back to the PT Coffee Cast. My name is Will Nicholson, and not with me today is my good friend Dalton Lano. But I've had something that I really have been wanting to talk about, which is a situation I feel a lot of students may at some point encounter or may have encountered already, or may be encountering it right now, which is the situation where you find yourself in a placement where you really disagree with your CI on a lot of things. I think this is a difficult situation because it does present a challenge where you really want to learn and you want to practice and develop in such a way that leads you towards how you want to practice as a physiotherapist. And this can definitely present a barrier. I've encountered it, and I've also had really, really good placements. Don't get me wrong. There's some great CIs out there that are great teachers, but they're also ones who are maybe less so fit for the job. And my hope is to just kind of share some of my experiences and some things that have helped, and maybe just get some discussion going on out there about maybe some things that have worked for you in the past or that have not worked. I think the first thing I really want to touch on is I found like you really got to keep your passion. A lot of times physiotherapists that have been working for years and years are less open to new research, and they've just kind of got into a routine where they're okay just practicing the way they've been practicing for years and years, and they're comfortable. Now is not the time, in my opinion, for us as students to get complacent. We've got a large career ahead of us, and if we're not excited and passionate now, then we're going to lose that real quick in our careers. And so I think that's just the most important thing, is to just keep your passion, keep your fire. Just because that placement is not somewhere that you feel comfortable, remember that you're treating people and they deserve your passion. Think about why you got into the profession in the first place. So that's number one, is just keep your fire, keep your passion. Number two is just kind of thinking about recognizing that there's a way to go about trying your approach. Something I've found that has really helped me is asking. If you don't ask, you're not gonna get the opportunity, right? So if you want to try a new approach, I found just asking, like, is it okay if I try assessing this? Or have you heard about this new research? Or can I even try doing some of these exercises I've been thinking about? The other thing that you can do is ask if your CI wants to hear your thought process. This is a way to, even at the very least, practice explaining your thought process. And usually people are open to hearing this reasoning, and I think you'd be surprised at how receptive your CIs are to letting you try things when you actually explain your rationale. The next thing is, remember to keep the patients first. Above all, like, the culture in the clinic and the consistencies are more important than anything else. Even if you're in disagreements, the last thing you want to have is confused patients. So unfortunately, sometimes you may just have to keep the thoughts in line with what your CI says, even if you do disagree. At the same time, you can still encourage people in a positive way and avoid perpetuating harmful thoughts further. Something I've found that's really helped is keeping the client's goal focused. See if there's positive things that they can try at home, and really try to figure out exactly what your client's goals were. Something I would do is just that, and I would relay this goal to my CI. So I make it really clear what the patient's there to try to achieve so that at least everybody's on the same page. And it allows us to narrow in on what we're trying to do each time this person comes in. So even if we agree on approaches, at least we agree on what we're trying to achieve. Also remember, you're not getting paid. This is something I've talked about before. I know we really want to, you're always kind of thinking like, you get in that environment where the clinic's really, really busy and the next patient's waited out there for you, but realize that you're not getting paid, and it's okay if you spend some extra time with some patients. Remember why you got into this profession again, and sometimes it's all right to just sit with a patient and just talk to them and kind of hear them out, which kind of leads me to my next point, which is listen and observe. You can't stop your CI from saying things that you maybe wouldn't say, but what you can do is listen and observe. How do your patients react to certain things? What are some common things that you're seeing? What are some things that do work? What are your patients trying to tell you? What kind of expectations do they have when you come from when they come for physiotherapy? You can learn a lot just by listening and observing and kind of getting a sense for how patients react when certain things are saying, so that you might know a better way to try to approach that in the future, or you might even see some things that work. The other thing is stay humble. Sometimes every thought you have isn't necessarily gold. Sometimes your CI is going to have really good ideas, and if you're already going in with that approach that you disagree with them and you don't think what they say is valuable, and you're not open-minded or humble, you might be surprised at the things that you miss out on. Even with CIs that I've really disagreed with, there's lots of things where I felt so valuable, whether that's some type of clinical technique or some way of communicating with the patient or navigating a difficult situation or even dealing with insurance or whatever it is. There's going to be stuff that you can learn regardless of whether or not you agree with what they're doing. You've got 6 weeks to learn, and you need to keep yourself humble and recognize that even though you have a lot of these good thoughts, there's still things to be learned no matter who you're with. I find that was super important for me to just step back and think, like, go in with a positive mindset at the beginning of the day that there's going to be something that I'm going to learn from this person. The last thing is kind of think about how you would do things differently. This will help you kind of exercise your critical thinking and start realizing that things are always very challenging and gray, and start to think about what you would do. If you disagree with how your CI did something, how would you do it differently? This might even, like, a lot of times for me, this led me to kind of doing more research because I realized I have no idea. Like, something that comes to mind is frozen shoulder. So I had quite a few people who had frozen shoulder on my placement. And I definitely didn't agree with the approach that was often taken during my placement, which was a lot of passive modalities. I felt like there was more to what was going on than what they were saying at the clinic. But I had no idea how I would approach it. So I went and I did a little bit of research, and I found some strategies that I think could potentially help in the future. So sometimes when you think about how you would do it differently, you actually realize that there's something that you need to look into in the future to kind of help guide that. So that's kind of my tips, some things that kind of help my mindset going through placement where you're struggling, and I hope that can help other people if maybe you're going through something similar. As always, let us know if you have any feedback or if you've experienced the same thing and you want to talk about it. We're definitely open to that. And if you've listened to our podcast and you've really enjoyed it, we just ask that you share this with one person and you give our podcast a quick review. And we really appreciate that. That just kind of helps get our podcast a little bit more exposure. As always, you can find us on Instagram, on Twitter, and on Facebook at the MBMT PTs. Thank you for listening, everybody. I hope you can gain something from this. Cheers.